Hi, in this video I'm going to talk to you about the dental care of the geriatric horse. We will be covering common pathologies, some of which have been covered in previous videos, but paying particular attention to what that can mean as your horse ages. Also, what to expect from your EDT or dental vet and what you can do to help support your horse and their mouth in their older years. My name is Abigail Bowyer and I am a BAEDT equine dental technician. I passed the BEVA BVDA exam in 2017, which has enabled me to perform dental treatments on horses, ponies and donkeys to the highest standard expected from a full member of the British Association of Equine Dental Technicians. I have also been working here at Redwings Horse Sanctuary for over 18 years now, where I qualified as an equine veterinary nurse. We have many geriatric horses here needing extra dental care, whether that be from me as I work through the more routine mouths, or from the experienced vets who will be dealing with the more advanced cases. There are often some common misconceptions when it comes to thoughts on dental care of the older horse. The most common one being that they don't need dentals as often or at all as they are retired. This is just not true. First and foremost, horses need their teeth to be in a good condition to grind their food for up to 20 hours a day. Although problems in the mouth can definitely affect the way a horse works under saddle, it is important not to forget this primary reason for the horse needing regular dental examinations. It is still just as important to carry out this level of care for the retired animal too. The process of chewing is an extremely important part of the digestive system. The guts cannot access the nutrients held within coarse fibre without it being ground up by the teeth first. Imagine you using a pestle and mortar in your kitchen. You can release all those lovely flavours from spices a lot better if you can give it a good pounding first. And it's the same for the coarse food, such as hay, that equines naturally eat. In fact, geriatrics often need more dental care as they age due to the potential for age-related changes, which can cause their teeth to become less effective. By keeping up to date with your horse's dental checkups, you can really help prolong the life of the teeth and so the life of your horse. Horses have what we call hypsodont teeth, so their teeth permanently erupt. This means their adult teeth are formed by around 5 years old, and from then on, their teeth erupt into their mouth at the same rate that they grind them away during chewing, which they spend hours doing every day. This makes the full tooth shorter and shorter year on year, until the tooth wears up so much it might fall out. There are, however, problems that can occur along the way. These problems, many of which were covered wonderfully in more depth by Misha in our previous video. They can be seen more commonly in the mouths of older horses and are as follows. Caries are decay of various structures of the tooth. The decay is caused by bacteria multiplying in the crevices of the tooth and feeding off the food matter, causing an acidic and corrosive environment. This can destabilise the tooth and make it likely to become infected and prone to fracture. Diastomata are gaps between the teeth that, once food matter gets stuck in and starts to fester, can then progress to cause various degrees of gum inflammation and infection. The gaps open up because as the horse ages and the teeth wear down, the cross-section of the tooth becomes smaller, and so the teeth won't wedge up against each other so easily anymore. Loose or missing teeth can occur due to imbalances or just simply the tooth wearing away to the point at which the ligaments have run out of grip. Overgrowths can then occur as a result of the missing tooth or misalignments. The teeth are permanently erupting, but without an opposing tooth to wear against, they can continue to erupt. These overgrowths can get very large and cause great discomfort to the surrounding tissues. EOTRH, or equine odontoclastic tooth reabsorption hypercementosis, mostly affecting the incisors and often associated with age. This can be a very painful condition where the tooth roots are resorbed and more cementum is formed, leading to a lot of inflammation and possible fractures. Unfortunately, we cannot stop this process, only support the horse by monitoring with x-rays, giving pain relief, supportive management methods, or unfortunately, by removing the teeth altogether. With some help from us, however, they can adapt and cope very well with this dramatic change. So smooth teeth occur as the teeth ages and wear away. The hard substance called enamel runs out. This enamel is what gives them the rough grinding surface. Without it, the tooth becomes polished and no longer grinds the coarser food. It's not painful, it's just less efficient. A lot of these pathologies can then cause ulcers, These are often symptoms of and caused by sharp teeth or debris caught in the diastomata, rubbing and cutting the soft tissues of the mouth, such as the cheeks or tongue. We know as humans how sore an ulcer can be, but it usually heals within a few days. Horses quite often have them constantly until we can treat the cause. Any of these problems can leave the horse with difficulty eating or even experiencing various levels of pain. Horses are prey animals, a characteristic of which is to be very stoic, making it sometimes hard to know if there is anything wrong with them, as they hide it so well. It's easy to think they must be comfortable in their mouth, as they are still eating and going about their life as normal. This makes it tricky to tell when there is anything wrong, and so they rely on us to know when to help. So here are a few things you can look out for to help you know when it might be a good idea to possibly bring your checkup forward. Quidding is where the horse is spitting out half-chewed food. It is most commonly their forage, as this is the harder thing to chew, and so it will be more obvious if they are struggling. This can be a symptom of any of the problems discussed previously, which can be a pain response or simply because of smooth teeth. If they've got difficulty chewing, they can sometimes look awkward and pull funny faces when trying to eat. Or weight loss or not gaining weight, this can be subtle and over a long period, or it can be quick, depending on the reason. Other more obvious symptoms can be facial swellings, which could be caused by food getting caught around misaligned teeth or in diastomata, or by infections of the teeth, bone or soft tissues. Another indication is smelly, snotty noses, which can be an indicator of sinusitis, possibly caused by a tooth root infection. Other age-related illnesses can reduce their immune levels, which can make them even more susceptible to this. All of these signs can be indicative of dental problems, but some of them can also be caused by other non-dental problems, so it is important to get a checkup in order to find out what can be done to help. So what can your EDT do to help? As horses age, we as owners need to support their bodily systems more. Making sure their teeth are in the best shape possible can have a positive knock-on effect through the body. Starting good habits of regular dentals from when the horse is young can greatly improve their chances of having a good balanced mouth well into their 20s and even 30s. Even once they are older and begin to have problems, meaning their care is focused more on comfort and nutrition, there is a lot we can do to make them more comfortable. Your EDT or dental vet can rasp the teeth to reduce sharp edges and reduce overgrowths. They can clean out gaps of festering food, which will help the gums to heal. Tooth removal is necessary in some cases, and although this sounds extreme and we try to avoid this as much as possible, it can help to relieve discomfort. Monitoring any problems that occur to ensure that they are dealt with in a timely manner is key. Some more severe problems may need vet referrals, and your EDT should be able to advise you further on when this is likely. An experienced dental vet will be able to do more advanced procedures such as diastomata packing or widening, tooth removal and even fillings, which can save the tooth and so prolong the effectiveness of the mouth. Early detection is best to prevent problems becoming bigger and so more painful and expensive to fix. So what can you do as an owner? Supportive care such as diet or management changes from an owner can greatly help a horse as it ages. Softer feeds such as soaked pellets fed little and often can be given to supplement their diet or even to replace forage, as they are easier to chew and so will aid better digestion. Feed companies such as Spillers have a variety of feeds perfect for this very purpose, so it is easy to find one that will meet your horse's metabolism and tastes. We have many ponies here at Red Wings that lead happy and full lives not eating forage and having 4 to 5 soaked feeds per day provided by Spillers. This many feeds in a day can be hard to implicate in a private home, but this is when discussing possibilities with your EDT or vet can hopefully come up with a way to work for everyone. Stopping using hay nets and offering any forage on the floor can help when the horse has possible EOTRH or short incisors, as the action of pulling at the forage can be tricky or painful. Saving the paddocks with longer grazing for the older horses, if their metabolism allows, can help for those same reasons. Grasping short grass may be trickier or even painful. These are all things your EDT or dental vet can help with to manage the more involved needs of your older horse. Remember though, age is not a disease. If your horse is skinnier or slower or quieter than they used to be, this doesn't mean that they are just old. They can be treated and made more comfortable, allowing you to keep them living a full and happy life. Hi, we're here at Red Wings HQ to talk to you about feeding the geriatric horse. I have Vanessa here from Spillers as they sponsor Red Wings to talk to you about feeding Rascal here, who's 31, and although he has all his teeth, they are quite expired, so there's not really much grinding surface there to be able to chew the coarser feeds. So Vanessa.
So with a horse like Rascal, he's all on mashes, isn't he now? It's really important when choosing your mash to make sure it's appropriate for the horse. So whether they need a lower calorie mash or a higher calorie mash. And just because they're old doesn't necessarily mean they need our senior super mash. In some cases it might be that the speedy mash fibre, the lower calorie mash, is the better option. So him being a good doer and a cob despite his age, we want to make sure he gets his minimum fibre intake, which is at least 1.5% of his body weight in dry matter of mash. So that way, it's also a balance between not only managing his digestive health, but his dental health, but his digestive health as well. So making sure he gets plenty of fibre each day.
So here we have Caesar. He is 29 years old and he's been here since he was born. He has multiple missing teeth also, but he also has diastomata, which are the gaps between the teeth that open up sometimes when they get older. He needs to be seen every 3 months by the vets, ideally. They sometimes even pack some of those gaps to make them more comfortable. So this is a different consideration while we're feeding them.
Yeah, so again, with him, it's very much a case of getting those regular checks to make sure, how big are these gaps? Are they getting feed packed in them? Some of the horses like him that are clearly very good doers and very food driven, they show very little signs of discomfort and pain, and that's where the dental checks are really important to clarify what he can and can't have. So again, with him, we try and avoid the short chop fibres, no long chop fibre, and stick to the mashes with him.
Yep. So here at Red Wings HQ, we have about 250 horses on this site alone, many of which are geriatrics with their own individual dental problems. We're really lucky to work with Spillers, the feed company, who bring a wide range of things to choose from.
I think, like you've just said, Abby, with 250 horses and ponies, you do need a variety of flavours, textures, to provide that enrichment and allow for individual preferences. So all of our forage replacers are fortified with vitamins and minerals, meaning that they get a balanced diet, which is so important for their long-term well-being. They're all, of course, high in fibre, so that we look after the digestive health as well. And on that note, it's so important that you guys continue with, you feed 4 or 5 times a day. You're very lucky with your team of staff. For the individual horse owner, that gets a little bit more complicated if they don't have time, or you're working, your family life gets in the way. So it's really important to reach out for help. Ask for help from friends, local people, off the livery yard. Can someone put in a late feed for your horse? But it's so important to make these meals as fresh as possible and split them up into little portions throughout the day to look after that digestive tract.
So here we have Gron. He's one of our long-term residents. He's 31 as well, but he has a lot of missing teeth. So his problems are slightly different from Rascal. He's a good boy.
So again, with him, he's definitely not a case of short chop fibres as a hay replacer. He definitely needs mashes. Just for the sake of enrichment, you may want to mix in a few high fibre nuts with him, just so it's not a completely sort of monotone diet, and a bit more variety and enrichment for him with flavours. I would also be very cautious with these little tots of making sure that you've know the history of them, if he's had any laminitis history, which I believe he has.
Yeah.
So we always want to make sure that these hay replacers are also low in sugar and starch and appropriate for his needs. So again, obviously the lower calorie speedy mash is ideal for him. Being small, he doesn't need so many calories as the senior product, but yeah, it must be a mash for him.